Let's talk about dark spots on our skin. Now, I've had patients coming up to me in clinic asking for their moles in inverted commas or dark spots to be lasered off. Here's the thing, a mole isn't just a mole, and a dark spot has many causes, some of which can be quite dangerous. Let's talk about them. You often hear people talk about freckles, and freckles essentially is a layman term for aphilis or aphilis, depending on how you pronounce it. A freckle happens when there is an overproduction of pigment, also known as melanin. In this case, the pigment producing cells remain the same in numbers and they are not increased. Freckles tend to be darker under UV exposure, especially during the summer, and tends to fade during winter time. The next common dark spot is a lentigo. Now, unlike a freckle, a lentigo happens when there is an overabundance of the pigment producing cells called melanocytes, and this leads to an overproduction of melanin. And so you can imagine that the pigmentation in a lentigo stays the same throughout the whole year compared to a freckle. Now, you can also get a very common lesion called a seborrheic keratosis, which is like this. Seborrheic keratoses tend to be quite rough and warty to touch, and they are essentially an overgrowth of dead skin cells. They tend to appear as we get older, and some people have loads of them due to genetic factors. The one thing you definitely don't want to miss is skin cancer, such as melanomas or precancerous lesions like lentigo malignus. These are the ones that you don't want to miss, especially without a biopsy, because if left untreated, they can potentially spread and be life-threatening. So next time, if you are thinking about lasering a mole off, make sure you get it checked by a qualified healthcare professional in the first instance.